Okay, I'm doing this video. We're gonna get this done. This one shouldn't be super long. Just know that you guys have like a lot of bones and bony landmarks that you guys need to know. We're gonna go over the appendicular quickly. Reminder, these are limbs. We already went over head and trunk last 2 weeks ago. The other thing I'm gonna go over, which I am suck at because I'm paralyzed and I apologize for that, is body movements. For body movements, I would suggest doing them. Get it, you have a body, practice doing these. That's what your flashcard should be. Okay. These exercises are not right as well, just so you guys know. Okay, so when we were talking about the axial skeleton, we were looking at roughly 200 bones. We're now looking at the appendicular, which is quite a few less. This is all the yellow tan bones here. This is about 126 bones. This is all of our appendages, all of our limbs. And then two kind of special places that we're going to talk about. One is the pectoral girdle, which is basically this area right here, your front of your back, and then your pelvic girdle, which is obviously your pelvis. Okay, let's talk about your pectoral girdle. It's mainly made up of two bones that are articulating with different things. Your clavicle, which is actually articulating with your sternum. And your scapula, right? And it holds the scapula and arm away from the thoracic cage. I know this PowerPoint doesn't have it, so I'm going to talk about it right now. For the pectoral girdle, there's a special amount of movements that these guys can do. It's called protraction and retraction. Protraction and retraction you can also do in your jaw, so retraction. I can't do that one really. Is it? You can also do that with your pectoral girdle. So this would be retraction, back like this, and in like this would be protraction. So pro, re. Okay. Next is your scapula. So, and your clavicle is articulating with your thoracic cage. Think of it that way, right? So, anteriorly. Scapula is the shoulder blade. You can feel that bone. Once again, you guys have a body. You should be checking this out. It's also, it does not actually articulate with the axial skeleton, which means it's not actually articulating with the thoracic cage. Its main articulation points are with the humerus. And you can kind of see it's kind of this weird looking bone. I think it's classified as irregular. You guys should know all the bony landmarks of the scapula. Just know them and know which muscles attach there and the movements that it helps do. Scapula is pretty versatile. Okay, so the upper limb, if we're going to go over these real quick, is meant for the humerus, right? So this bone right here is your humerus. Your forearm, which has your radius and your ulna. So the radius would be on this side, and your ulna would be on this side. You can see between those two things, between the radius and ulna on this picture here, you have this webbing. This is known as interosseous membrane. It's a fibrous connection. We're going to talk about that here in a minute. And then lastly, you have your hands. So the things that you need to know for your hands are phalanges. So the part that you can move is the phalanges. This part in here, that's your metacarpals. And then the parts that make up your wrist bone articulate with your ulna and your radius are known as your carpals. You don't have to know the specific names. You just need to know phalanges, metacarpals, carpals. Okay? You should be able to do those things, no problem. Okay, pelvic girdle. The pelvic girdle is actually made up of two bones that are connected via this pubic symphysis, which you can see down here. Maybe if I can get see that guy right there. You guys should be able to take each one of these coaxals and be able to position it so that you understand where these other three bone fusions are, right? So just being able to position them correctly anteriorly, posteriorly, and laterally will really help you figure out what bony markings are what. So when you look at one of these coaxial bones, which I wish I had with me, it's actually a fusion of 3 bones. The top part being, you can see it's this thin crest, which is known as actually the iliac crest, is the ilium. You can feel that bone actually on your hips, right below or right above your groin area on either side. Next is the ischium. So on the ischium is down here. So this is the part that you are sitting on. It's the part that I'm sitting on right now, at least. This is your butt bone. The ischial tuberosity is that bony part of your ass, okay? The last part is the part that actually forms the fupa. Do you know what the fupa is? Which is known as the pubis, right? So this is the pubic area, and you can see that pubic symphysis happens right there. So once again, like I said, being able to orient that coaxial bone so that you know which way it's facing, so you know where the ilium, the ischium, and the pubis are going to be really important. I can almost guarantee that you will have at least one disarticulated coaxial bone on your exam. I could not fathom an exam without that, to be honest. You have this really special bony landmark that also happens on the coaxial bone. You can't see it really well in this picture, but if you turn it to the side, you'll see this big old hole area where that femur head sits just beautifully. This is known as the acetabellum, okay? That's its very special name. It's not known as anything else. That deep pocket that holds the femur head is known as a acetabellum. Okay. You guys need to be able to identify the difference between male and female pelvises. You can imagine why there would be some differences between these two things, right? So one is, this is where babies come through, right? So you'd imagine that the female would probably have a slightly larger pelvic inlet, right? So these are, here, let me hide my head real quick. Here are some characteristics for distinguishing between the two. I'm going to tell you which one I think is the most fail-proof one, for me at least. This one has held true almost any pelvis I've ever looked at, is looking at the pubic arch. So that's that arch where the pubis areas of each coaxial bone are coming together to form that symphysis, right? So you can see my thumbs are already making it that shape. So if you look at this arch, when you're looking at a man's, you'll see that it's actually much more thin and narrow and pointy, whereas a female's will be wider. It's going to be more like a McDonald's arch, like that. So versus like this. Okay. That's how I would do it. Anywhere. If I was a forensic coroner, I'm sure that's the name for it. That's how I would identify if it was male or female. Okay. Let's talk about the lower limb real quick. So we already kind of talked about the femur and the femur head. Remember that the pit, the depression that makes up the pelvic, or the thing that the femur head goes into, that's the acetabellum. So we have femur, and then we have one of our only sesamoid bones that we're going to talk about, which is the patella. If you don't know what sesamoid is, please look that up and understand how and why the patella is considered a sesamoid bone. Next on the tibia, on the leg, is you get the tibia and the fibula. I heard this for the first time this year. So the tibia makes up that shin bone. So when you feel your shin right now, you can feel that line right there. So I'm going to say this again. I think you've already heard me say this once. The linea aspera. Oh, I think I'm butchering that. But this occurs a lot on bones. You have one on your humerus as well. It's kind of the sharp line that occurs. And then you have your fibula, which is the smaller bone. And you can see once again the tibia and the fibula are attached by that one of those interosseous membranes, which is a fibrous connective joint. Somebody told me this that really made sense is to remember these is you tell a little fib. You tell a little fib, right? Fibula is smaller bone than tibula. It's a little fib. Nice. Okay. Let's talk about the foot. So foot is very much like the hand, where you're going to have phalanges, which are your toes. And then instead of carpals, we're going to have tarsals, right? So the tarsals are now like this area of the foot. And then the metatarsals, and then the tarsals being the part where you're going to join up with some of your ankle bones. So you guys need to know 2 specific bones in the feet besides the tarsals, the metatarsals, and the phalanges, and that is the talus bone and the calcaneus. The calcaneus makes up the heel, so if you were to stand on your heels, you'd be standing on your calcaneus. It kind of looks like this rectangular shaped bone. You guys should be able to find it disarticulated and know what it looks like. The talus is more, it looks like a short bone as well, and it's more cube shaped. This is where the talus actually articulates with, you can see on this side over here, this with the tibia. And it actually has a nice little hinge joint, I think, or saddle joint on the top of it, and it has a nice little joint on the below it too. So when you guys should also be able to find those disarticulated. If you are having difficulties with that, let me know and I will show you. Okay, so we talked about the pelvic girdle, we talked about the lower limb, we talked about the upper limb. Okay, let's talk about articulations and body movements real quick. Joints. There are 2 ways to classify, okay? First, you have these functional classifications, which tells you how much the joint can move, okay? If you have synarthrosis, that means that the joint is immovable. Places where you have synarthrosis, I think, are places like your clavicle to your sternum are one. Sutural joints, right, in your skull, the ones that can connect your like your parietal with your frontal bone, those are synarthrosis. Then you have things like amphiarthrosis, which are slightly movable. So you just heard me talk a bunch about that pubic symphysis. So the pubic symphysis, which is right here, actually has a little bit of bend this way. And then this last one, diarthrosis, is freely movable joints. And if it is a freely movable joint, it is a synovial joint. That's what it is. That's what it is, okay? If you're freely movable, you have a synovial joint. Synovial just means that it's like a fluid film. We're going to go into what the anatomy of that is here in a minute. But I want to go over these structural classifications. Structural classification is just describing the tissue that is making up this joint. So when we're talking about these fibrous joints, these are things like that interosseous membrane that's happening between our fibula and our tibia, or between our radius and our ulna. The sutures that are occurring between our skull bones, those are fibrous. Just because I've been using the shit out of this one. The pubic symphysis is actually cartilaginous, right? So this is a place where you get that hyaline occurring. Another one is those joints between like your manubrium, right? So the top of your sternum to the body of your sternum. That is also a cartilaginous joint. And those costal cartilages, right? Those are all cartilaginous. Synovial is one that is special. This is this one that is freely moving. So each one of these, synovial joint, synovial, okay? Synovial joints are freely moving. Okay, so we already kind of went over this. We talked about these sutures. We talked about these synostosis between the tibia and the fibula. Oh, this one is special. The gomphosis. This one is specific to your teeth. Okay, there's a periodontal ligament that just attaches the bone, the tooth into the bony socket. Okay, so if I say gomphosis, gomph I think means mouth. I don't know. You should look that one up. Here are some of those cartilaginous joints. So here you can see that pubic symphysis, your intervertebral discs, which are made up of what type of cartilage? Fibrocartilage. Okay. It's also considered amphi. And then those synarthrosis, so those synarthrosis, that's those costals, right? So the costal cartilages are all synchondroses. So this is what a synovial joint looks like. You guys should at least once draw this out in your life. You should be able to identify these things so you can see a ligament is happening. So remember, ligaments take up less room to cover those joints. You see these joints are kind of bulby. So you can see you have the articulating cartilages, which are covering either bone side, right? And then you get this fluid that's happening between them so that they're actually not touching, which is great, right? That is known as synovial fluid, which is filling that joint cavity. We've got the articular cartilages. You have a fibrous layer that goes over that, and then you also, underneath that is the synovial membrane, which is actually secreting. So if it's secreting synovial fluid, what type of tissue do you think it is? If you did not say epithelial, I'm going to punch you. It's epithelial tissue, right? If you secrete, you're epithelial. And just a reminder, you can see the periosteum right here. So that's that outer thing. Let's see what my head's. The articular capsule is what's made up of the fibrous and the synovial. Over here on the left, you can see these 6 different words. These are the 6 different types of synovial joints you can have. So ball and socket, condyloid, hinge, pivot, plane, and saddle. I don't know if it doesn't go over these, I will go over myself. Yeah, okay. So when you think of ball and socket, what you're looking for is like those bones with the ball, and you're looking for the socket, right? So one of the most easy ones you're going to think of is femur, right? So femur, it's got that acetabellum. Femur head goes right in it. You also, your humerus here has that. Oh, you know what? I think the next slide actually has a bunch of these. Yeah, okay. So all these joints are capable of doing these types of movements. So you guys should know which joints are responsible for which types of movements and which ones can't do which movements, because that'll also help in terms of like process of elimination in the exam. It's one of my favorite exams just because it's so hard. You can really see people putting effort into the class, those who care about it. But the main reason is because during this exam, everyone's making these motions, and it's like the funniest thing ever. If you're not making these motions during the exam, I don't think you're going to get a good grade. I don't. Why wouldn't you use the tools in front of you, right? Okay. So when you guys are thinking about these movements, I want you to remind yourselves that these are usually paired motions, right? So the first thing we're talking about is flexion and extension. These are things that are happening either anteriorly or posteriorly, right? So you can see that flexion is moving away from the body and extension is moving towards. So the joint I'm about to talk about, is condyloid. So if I'm making this motion, which bones am I using? I'm using my atlas, right? So I'm making the up and down motion. So if you remember, there's on the side of that magnum foramen of the skull, you have those occipital condyles that are articulating with the atlas's condylar facets, basically, to rock on those. So condyles are going to give you those types of forward-backwards movements, but not a whole lot of that side-to-side movement, okay? So you can see here, we've got a ball and socket in terms of the arm, right? Synovial diarthrosis, right? Down here, we have a hinge, right? So that's the tibia articulating with the femur. Here we're doing a symphysis, right? So instead of doing this, which is the atlas and the skull, they're doing this, right? Which is the intervertebral discs. Okay, so we got some more flexion and extension. Remember, those are moving forward and away. Now we're going to talk about adduction and abduction. So adduction is happening laterally to your sides. So adduction is moving towards the body, and abduction is moving away from the body. And you can't see me right now. The other one is that we have here is circumduction. So this is anytime you can like rotate a joint around an axis. So look at this. Oh, look, this is circumduction. I can do it with one of my fingers. Oh yeah. Okay. Circumduction doesn't have a flip movement. Okay. Okay, so here we have some more symphysis, cartilaginous amphitherosis, ball and socket, right? So that's happening in the pelvic girdle. These ones are also ball and socket up here, right? And I actually think the circumduction of the wrist, I think it's actually planar. I don't think it's ball and socket, the circumduction of the wrist. Somebody should look that one up for me. Let's talk about rotation. So we know that this is the axis articulating with the atlas, right? You can get medial and lateral rotation, but that's specific to limbs. So your head obviously can't do a lateral or a medial rotation. It's just doing rotation. But if you're using like your, say your wrist, I don't even like using this one because this is actually pronation and supination, which is specific to this joint. We haven't got to yet. But you can see here on his limb, which is a ball and socket joint, he's doing lateral rotation, which is moving his leg away from his midline, whereas medial rotation is moving his foot towards the midline. Okay, so I kind of talked about this one already, is pronation and supination. These things are specific to the forearm. So you can see in pronation, your radius and ulna are crossing over, and you can't see it in my arm because they're under my skin. But when they're parallel, they are in supination. Okay. Here's some other specific things. This is for the foot. So when you are on your tiptoes, that's plantar flexion. When you're pointing your toes straight up and you're on your heel, that's dorsiflexion. So remember, dorsal means top of, right? And then you can get inversion and eversion. So inversion is when you're on the outside of your foot, like if you were to stand on the outside of your foot, and an eversion would be as if you were standing on the inside of your foot. So this is a pivot joint, hinge joint, right? So that's the talus that's doing that. And then this is planar, which I think is the same for your wrist on that previous one. And this will be, if it's going there, I think this is the talus and the calcaneus articulating, but no, it's the talus and I think it's the tibia and the fibia again. You guys should look that stuff up though. Okay. That's all you got for movements. I want to emphasize running through your movements. I want you guys to practice naming bony landmarks. You guys should be now moving on to not just knowing the bony landmarks, but like knowing specific bony landmarks. You guys should also be able to do most of the bones. The bones should be pretty easy. If you're still getting stuck on the cranium, put it down for a minute. Maybe come to office hours and we can do the cranium together. Body movements, don't forget to do those. Especially when we start laying on muscles next week. You guys are going to get names of muscles next week, and then it's going to be your exam. You guys should be able to easily figure out what the movements are that things are capable of. Okay? Okay.